Good day. I am Dr. Wilfredo S. Tagle, urologist, and welcome to this week's episodes of Medical PracTIPS, a series of tips and tricks to start your medical practice. For this episode, we will be continuing the Code of Ethics of Physicians. Be sure to watch episodes 6 and 7 to catch up. So get ready, sit back, and relax. And we will start with our 8th episode of Medical PracTIPS. Today's episode will focus on Article 3, the professional responsibility to patients. For Article 3, Section 1, the professional competence of physicians. So, in this section, the physicians are committed to lifelong learning and give a holistic, competent, and compassionate medical care, and also uphold the highest professional and ethical standards and respect for human dignity. That means the physician should continuously seek for continuous knowledge about their craft. Hindi lang po yung 10 years na studies. We have to continue learning, looking for some knowledge about their craft. And the physician should provide holistic, competent, and compassionate. Laging para sa pasyente yung tender, loving care. And of course, within the bounds of ethical and respect for human dignity. Next is the 3.2, patient's trust. This means, under this, maintain a fiduciary relationship with their patients by displaying competence, reliability, integrity, and open communication. That means we have to maintain the trust and confidence of the patient. But we have to earn this by giving competence, and you have to be reliable. Have always an open communications to your patients. Tell them what's going on, what to expect, and what are the possibilities of your treatment. Next, for Section 3, it's about human dignity. The physician must be compassionate, approach the patients courteously, conduct PE modestly, caring, and be gender sensitive. Importante po yan. Ensure the free and informed consent of your patients to preserve their dignity and anonymity. That means always tell your patient what are you going to do, especially when you are going to do physical examination. Be sensitive. Isipin nyo ang pasyente kung nahihiya or baka masyadong aano nyo yung kanilang privacy. Okay? So, kailangan maging sensitive ka sa patients, especially to their gender. Pag ang patients ay babae and you're male, kailangan merong kalaging nagbabantay or third person na babantay para hindi mahihiya yung patient. Okay? For Article 3, Section 4, this concerns the professional fee of the doctors or the physicians. You have to ensure a reasonable and commensurate professional fees to the services rendered, the nature of the case of the patient, the risk involved, the professional standing of the physicians, and the financial status of the patient. Of course, kung mahirap yung kaso, siyempre, dapat naman bayaran yung doktor ng mas mataas. Kung madali ang kaso, okay lang na ibaba naman. And with regards to financial status of the patient, kung okay naman at pwede namang magbayad yung pasyente, i-charge mo the regular rate. Pero kung ang pasyente nakikita mong talagang hirap na hirap, minsan naman magbigay ka ng mababang presyo or mababang professional fees. And to the patient naman, pag nakikita nyong talaga naman yung doktor nyo ay di kalidad, di kampanilya, syempre, magcha-charge naman siya ng medyo mataas. Compared naman sa mga doktor na bagong graduate, na medyo mababa naman. And to the new graduates na doctors, huwag nyo naman i-charge yung bago nyong patients na kasing taas ng charges ng inyong mga consultants na talagang seasoned doctors na. Medyo bumaba naman tayo konti. Yun po ang ano. Okay. So, for 3.5, the next section, for Article 3, Section 5, this is about disclosures of information. The physician shall neither conceal, understate, nor exaggerate the patient's condition. Inform the patients for need for referrals to appropriately specialists if indeed needed. All communications regarding diagnosis and treatments are understood by patients and their relatives. So, ibig sabihin, the physicians will not disclose any information regarding their condition. You have to be open and transparent to the patient. What are the possibilities? What are the possible complications and the possible outcome? You have to tell it to your patients. And of course, if you are not the specialist for that kind of field, even if it's on your specialty, it is not your subspecialty, you have to tell the patient that you have to have a second opinion or possibly refer your patient to a doctor who is more competent for that particular disease from you. Okay, that's it for today's episode. Tune in for next week's episode and continuation of Article 3. Remember, Wednesday, 7 p.m.